Handling bad patient outcomes can be some of the most stressful times of a healthcare provider's career, not to mention the stress and possible injury endured by patients and their loved ones. There are a few terms commonly used to describe bad patient outcomes. An adverse event is when a medical intervention of some sort results in harm to the patient. Once an adverse event occurs, it's important to disclose it to the patient advocate if the patient is unable to comprehend the disclosure due to their medical condition or mental status, and/or the patient's family as soon as possible. Even if a full investigation has not been completed yet, it is best to share the known facts early on, and to provide assurance that additional factual information will be disclosed as soon as it's discovered. Especially in the early period of an adverse event, knowing exactly how or why it occurred is difficult to determine. Therefore, when it comes to answering questions with unclear answers, it is best to avoid speculation. Knowing how to say sorry is important. Saying, "We're sorry we did this to you," claims responsibility. On the other hand, saying, "We're incredibly sorry that this happened to you," conveys empathy. This acknowledges the bad outcome, helps to minimize emotional trauma, and begins to repair the doctor-patient relationship. Patients also want to know why this happened, what can be done to help fix it, and what preventative steps will be taken in the future. Involving other staff, like a risk management officer, allows for another reliable point of contact for the patient outside of the physician. Healthcare providers should also contact their malpractice insurance carriers as soon as possible to gain advice on what protective steps should be set in motion. On that note, many states in the USA have enacted so-called apology laws that prohibit the content of a disclosure from being used against the healthcare provider in a lawsuit. When conducting an investigation, a root cause analysis is used to determine what exactly led to the adverse event. The outcome of this may include so-called weak actions, like instituting checklists or policy changes that still require an individual to act in compliance, intermediate actions, such as requiring providers to answer mandatory questions within the electronic medical record when ordering a test or medication, or strong actions, including eliminating products or services that are deemed to be inherently unnecessary or unsafe. Alright, as a quick recap. Once an adverse event occurs, it's important to disclose it to the patient and/or the patient's family or patient advocate as soon as possible. It is best to share known facts with the patient or the patient's family early on, while being careful not to speculate or admit fault when the entire picture is unclear. When disclosing an adverse event, it's important to think through what's going to be said and to do it with honesty and empathy. For more information on this topic or Coverys, email riskmanagement@coverys.com or visit coverys.com.